Published 1821 EDT, the 23rd of August 2017. Updated 1821 EDT, the 23rd of August 2017. HIV/AIDS is no longer the leading cause of death for people in Africa. New statistics reveal. The World Health Organization's most recent data showed the crippling illness is now the second killer in Africans after years of campaigning for better contraception and education about the sexually transmitted disease. Lower respiratory tract infections such as pneumonia and bronchitis is now the most deadly disease on the continent. There were an estimated 760,000 deaths due to HIV/AIDS in 2015, which has dropped from the 1 million deaths in 2010. Although fewer people are dying from the disease, experts say the number is still too high considering preventive methods and education efforts have gotten better. HIV/AIDS is no longer the leading cause of death in Africans. It has moved down to the number 2 position, with lower respiratory tract infections being the leading cause. This picture is from Zambia, where a nurse was taking a patient's blood to see if they had HIV. New statistics from Africa Check, an African fact-checking organization, revealed that the leading cause of deaths for people on the continent. Lower respiratory tract infections took number 1, with the most common of those diseases in this category being pneumonia and bronchitis. Pneumonia is a viral, fungi or bacterial infection in the lungs that can cause the air sacs to inflame and make breathing difficult. Bronchitis happens when the bronchial tubes in the lungs get infected. These tubes are responsible for carrying air in and out of the lungs during respiratory processes. In 2015, an estimated 16% of children under 5 across the world died from pneumonia or bronchitis, making it the world's leading cause of death for this age group. Scientists may be one step closer to developing a cure for HIV, research suggested yesterday. An injection may soon be available that prevents the virus spreading and could rid sufferers of the infection, a study implies. Researchers from multiple institutions, including Texas A&M University, injected cows with HIV, all of which developed an immune response within as little as 35 days, a study found. When the immune cells of the cows were analyzed, one in particular was found to bind to a key site on HIV that the virus uses to spread infection, the research adds. The researchers believe such immune cells could be incorporated into an injection to neutralize HIV in infected humans. Currently, there is no cure for HIV, with patients usually being required to take lifelong medication that causes nausea, diarrhea and insomnia. HIV/AIDS is now number 2 on the list for deaths in Africa, and it took an estimated 760,000 lives in 2015. This is lower from the estimated 1 million deaths in 2010 from the disease. Efforts have been made to lower the death rates by increasing preventive and educational methods across the continent. But HIV/AIDS still plagues people living in Africa and around the world. Third on the list was diarrheal diseases, which are caused by viral, bacterial or parasitic infections in the bowels. This is also the second leading cause of death in children under 5 across the world and in Africa, according to World Health Organization. These infections are caused by dirty and unsafe water, poor hygiene and bad sanitation around where people are living and eating. Fourth on the list was people dying from strokes, which has increased since 2010. A stroke is caused when the blood flow to the brain is stopped or reduced. Brain cells are not able to get enough oxygen and nutrients, so they begin to die. Heart attacks are 5th on the list, and have pushed malaria out of the top 5 for the first time in years. Most of the above diseases are preventable with sufficient funding and access to better care. Countries in Africa, though, continue to be plagued with poverty that has affected residents' ability to get the care needed to treat these diseases. But poverty levels have been improving in Africa since 1990. In 2012, only 43% of the population lived in poverty compared to 56% in 1990, according to World Bank.